Okay, let's dive right in. We're about to go on this incredible journey, but it's not what you think. It's not through space or across continents. It's the journey a drug takes right inside your own body.
You know that feeling, right? You pop a pill for a headache and just trust it to work. But have you ever stopped to wonder what's really going on in there? How does that tiny little tablet find its way and know exactly what to do? Well, that's what we're going to unpack today. So, here's our game plan. We're going to follow the pill's journey from the very beginning. See how your body processes it, how it makes its grand escape, then we'll get into how we measure its stay, and finally, we'll crack the code on why your prescription says to take it at specific times.
Now, this whole wild ride has a pretty fancy scientific name, pharmacokinetics. I know, it's a mouthful, but all it really means is the study of what your body does to a drug. You can think of it like the drug's biography, written by your body. It covers everything from how it gets in to how it gets kicked out. And chapter 1 of that story starts at the body's main processing plant.
So, our first major stop is the body's processing plant. And for the most part, we're talking about the liver. This is where the drug gets a total makeover.
This whole transformation process, it's called metabolism. And it's actually the body's super clever way of chemically changing a drug. But here's the kicker. It's not to use it, it's to get it ready for removal. Your body is basically putting a tag on it and saying, all right, your job's done here, time to head for the exit.
Now, your body doesn't just do this in one fell swoop. As you can see here, it's actually a two-phase operation. But it all comes down to one single goal. Make that drug water-soluble. Why? So it can be flushed out of your system. So let's break that down. Phase 1 is kind of like the prep stage. Your body adds or uncovers a little chemical handle on the drug molecule. Then, in phase 2, it attaches one of its own water-loving molecules right onto that handle. And boom, the end game is achieved. The drug is now what we call a metabolite, and it dissolves super easily in water, all packed and ready for elimination.
Okay, so the drug has been processed, it's been packaged for removal. Now it's time for the great escape. Let's look at the body's main exit routes. The number one exit ramp is through your kidneys. I mean, think about it. They act as this incredibly sophisticated filtration system. Blood flows in, the kidneys pull out our newly water-soluble drug metabolites, and they're sent on their way out of the body through urine. Simple enough, right?
Well, the story doesn't always end there. For some drugs, the body has this fascinating plot twist, a way to give them a second chance to get back in the game. And here it is. It's called enterohepatic cycling. This is a pretty mind-bending recycling loop that happens between the liver and the gut. So instead of being eliminated for good, some drugs are actually sent back for another round.
So how does this actually work? It's a four-step dance. First, the drug gets processed in the liver, just like we saw. Second, it's shot out into the gut through something called bile. But then, and this is the really cool part, bacteria in your gut can actually snip off that water-soluble tag we just added, essentially reactivating the drug. And finally, that now active drug gets reabsorbed right back into your bloodstream to do its job all over again. This whole process can make a drug's effects last way, way longer.
So we've seen the physical journey, which is pretty amazing. But how do scientists actually measure all this? Let's switch gears and look at the elimination countdown. The ideas that tell us exactly how quickly drugs leave your body. Okay, the first big metric is called clearance. It sounds complicated, but the analogy is perfect. Just think of it as the efficiency of your body's cleanup crew. It's a measurement of the volume of blood that gets completely cleared of the drug every single minute.
And this diagram shows perfectly how they figure that out. Scientists literally measure the drug concentration going into an organ, like the kidney, and then they measure the concentration coming out. The difference tells them exactly how much drug was removed. In this case, you can see 500 micrograms are removed per minute, and that lets us calculate the clearance rate.
So when you run the numbers, you get a real concrete value, 50 milliliters per minute. That's not just an abstract idea. It's a tangible measure of how fast the body is working to get rid of that specific drug. All right, so let's look at what this cleanup job looks like over time on a graph. This chart shows the drug's concentration in your blood. You see that first really steep drop? That's what we call the alpha phase, or distribution. That's the drug just quickly spreading out all over your body. Then that second, more gradual slope, that's the beta phase, or elimination. That's the part we've been talking about. And right here, on this elimination slope, we find our next super important concept, half-life. You'll see it written as T-half. You can think of it as the drug's official countdown clock. It's simply the time it takes for the drug concentration in your blood to drop by exactly half. See on the graph? The time it takes to go from a concentration of 4 down to 2, or from 2 down to 1, that's the half-life.
But, of course, there's another little twist. Not all drugs play by the same countdown rules. Most drugs follow what's called first-order kinetics. This just means the more drug there is, the faster your body eliminates it. Makes sense. But some things, and alcohol is the classic example, follow zero-order kinetics. This is where the body gets rid of it at a constant, fixed rate, no matter how much you've had. And this graph shows exactly why that difference is so important for safety. With first-order kinetics, you get that nice, predictable, straight red line. If you double the dose, you double the level in your blood. Simple. But look at that blue curve for zero order. A tiny increase in the dose can cause a huge, unpredictable spike in blood levels. And that can be really dangerous.
Okay, let's tie this all together now. All these concepts we've talked about, metabolism, clearance, half-life, they aren't just for textbooks. They are the absolute key to cracking the dosing code. They answer that fundamental question, why do you take your medicine the way you do?
So when your doctor says take 1 pill every 8 hours, they're not just guessing. They are using that drug's half-life to do exactly this. Each new dose is timed perfectly to show up just as the last one is starting to fade. The goal is to keep the drug concentration inside that sweet spot, what we call the therapeutic range. You don't want it too high, where it could be toxic, and you don't want it too low, where it's not even working.
But even then, you can still get those peaks and troughs, right? The ups and downs. So to smooth things out, modern medicine came up with brilliant solutions like the controlled release technology you see on the right. This kind of clever pill design lets the drug out slowly and steadily over many hours. It avoids those jarring ups and downs and gives you a much smoother ride.
So from a simple swallow to this incredibly complex dance of metabolism, elimination, and even recycling, it's a truly amazing system, isn't it? So the next time you take a pill, maybe you'll think about its incredible journey.